how we operate as an organization.
Good. Right. Thank you, Ms. Miller. I appreciate that. And I appreciate the idea that a consultant will come on to help work through some of the issues here. But ultimately, a program like this, as other programs and that I'm sure the department or the park board is involved in, has to have some kind of responsible oversight of a permanent nature. So a consulting may be helpful on a short term, but I'm particularly concerned that you may not have one person that will be overall responsible for this. And it raises questions in relation to this particular audit on whether you have some kind of program around workers' compensation. How does the issues raised in this report reflect on workers' compensation responsibility of the park board as well?
Commissioner Fisher and Chair Palmisano, I did not answer that question originally. Actually, the Deputy Superintendent, Jennifer Ringgold, who's also here, will be the point person for our organization for overseeing the safety program in the organization. She has responsibility for our HR department, where all our worker compensation issues are addressed, and actually had conversations with our worker comp staff as well about some of the safety concerns. And this has been, since 2010, an effort that we have made organizationally to try to address safety. I recognize that we still have a long way to go. We've made significant changes operationally in mechanizing our most dangerous work activities, forestry, and trash collection, because we were having a number of issues and we've mechanized things. We also have aggressively tried to address workers' comp issues. So I view this, while we have a lot of work to do, a continuation of work that we started in 2010 to address worker safety issues in the organization.
Mr. Neal.
I don't know if this question is best directed to Ms. Miller or Mr. Vasilev, but when you were examining the safety program and performance, did you see evidence of excessive loss or personal injury for park users? Was there anything like that? Was there evidence that the lack of this of a kind of a formal safety program was leading to actual physical harm and property damage on the loss side?
I think the answer to that would be no. We did not focus on the monetary workers' comp end. We focused on the employee safety end. But I think employees generally were aware of their safety responsibilities and tried to be safe. There's just some systematic structural elements of a safety program that we were pointing out that could be improved to make sure that those employees were not missing aspects of safety. I think we had some observations where there were opportunities to better maintain equipment through better training or through better training for some seasonal staff to better increase some preventative maintenance that was challenging to keep up on based on employee statements from staffing levels. So there might be some opportunities there, but there's no direct tie-in of, there was no safety committee, therefore this is broken and this employee is injured. That's a really difficult tie-in to really show.
Mr. Vasiliev, what staff safety concerns did we hear about in your fieldwork?
Madam Chair, as I know, there's some concerns about having enough employees to do some preventative maintenance in addition to doing repair work needed to keep things functioning. I think it's also very important to point out that some of the findings and observations we had in the report were also noted by employees to us, that it wasn't a complete mystery, but some staff had some information on, on safety inspections, on safety committee issues. So those were brought up by staff. Some concerns about space to do things like store equipment or set up office space locations. Some older equipment, which, as Dan Miller pointed out, has been in the process of getting updated or replaced since 2010. Specifically, some arborist equipment has been updated and replaced. Trash collection equipment has been replaced, but there's still an ongoing process. I think there's a 5-year plan to get all of the more outdated equipment up to date, and staff concerns definitely pointed out that they're working with something that was a little bit older, that required more maintenance and more repair.
Thank you. Could you tell me what was the general staff and management attitude or approach to safety that you noticed through your work efforts?
Madam Chair, as I said, the general attitude seemed to be pretty good. The employees knew that they were responsible for being safe, for wearing their protective equipment. Supervisors were aware that they were responsible for keeping their staff safe, for providing what they needed. I think the degree to which safety was on people's minds varied from department to department. And some of the higher risk areas, like arborists, actually had very proactive approach and had things like within the department, management got together on a weekly basis to discuss safety. So there were some very good examples where staff were, proactively keeping safety in mind.
How well, there were a number of findings in the report. One of them was about having one person focused on safety work. Can you tell me how well that worked when it was implemented?
Madam Chair, I think the issues in the report, they don't start in 2014 when this individual started or 2012. They're an ongoing process. And I think the individual had a number of roles and responsibilities that they were given and had a lot of work that needed to be accomplished. I think that the scope of what needed to be done wasn't necessarily clear, and the targets weren't really necessarily clear. And so it was difficult for one individual to get in there and be in charge of the entire program without some of the additional groundwork of support of a safety committee and support of some of the distributed roles and responsibilities for safety and safety champions within the organization to assist. So I think it could have had more progress, but to have that additional progress would have required some additional funding or additional time from a variety of employees.
Mm-hmm. Thank you. Other questions? Mr. Neal and then Ms. Walensky.
Just a couple more questions about the safety committee itself. And I'm still not clear. Is it established or it's going to be established?
Madam Chair, Committee Member Neal, as far as we were told that it is set up and that it'll be meeting this month, but we haven't verified anything.
Okay.
So my understanding is that the first meeting will be occurring this month. Okay.
And maybe, Ms. Miller, if you could say a few words about how will you select the people to be on it? Will they volunteer? Is it a equal sort of labor management kind of organization?
I'm actually going to ask Jennifer
Okay.
Ringel to answer that because she knows the details of that committee.
Thank you. Madam Chair, committee members, I'm Jennifer Ringel, Deputy Superintendent for the Minneapolis Park and Recreation Board. Within probably the last, I want to say 6 months, we had the joint agreement that is a labor and management agreement that establishes a safety committee. That basic composition, what usually happens there is you tend to have one more labor appointment than management appointment. So moving forward, we have a 13-member committee. 7 of the members are labor and 6 of the members are management. The labor appointments are made by their bargaining units. So those places are in place now. Our first meeting is January 26th.
Thank you.
Great. Thank you. Commissioner Walensky.
Thank you, Chair Palmisano.
Oh, it's blue. That's pretty.
First, I'd like to thank the audit staff for completing this very thorough audit requested by Superintendent Miller. As a commissioner at the Park Board, am I disappointed? Yes. Surprised? Not really. With the hiring of Superintendent Miller, the Park Board has been systematically going through the various departments, policies, and procedures at the Park Board and doing our best to bring things up to 21st century standards. I'd like to thank the Park Board staff for their cooperation with the Auditor's Office. Knowing where we are in need of improvement, while not pleasant to hear, is necessary to move forward. I also want to make sure that it is known that the commissioners at the Park Board are serious about employee safety and will work to ensure that the recommendations of the Audit Committee and the path forward provided by the superintendent will be followed. On that, I would like to make the following motion. I would move that the Audit Committee refer this to the Operations and Environment Committee of the Minneapolis Park and Recreation Board with the following instructions. 1, that a presentation to the full Board of Commissioners of the Park Board be made by the City of Minneapolis Auditor's Office. And 2, that the staff from both the City of Minneapolis Auditor's Department and the Park Board work to set up a system to ensure progress is made and reporting on same is ongoing both to the Auditor's Office and the Operations Environment Committee at the Park Board. The reporting time frame and format should be worked out by the aforementioned staff, but should be no less than annually.
Great, thank you for that motion. I'd be happy to entertain that motion. Is there a second?
Second.
Mr. Neal seconds it. I understand there's still a few more questions about the audit itself, but I'm comfortable if others are. Is yours in regard to this motion or just additional questions? Okay, so we will get to that. But on this motion, as presented by Commissioner Walensky, all those in favor? Aye. Aye. Opposed? Thank you. Thank you. That carries. There are some additional questions up here for staff about the results of this audit. Let me start with Councilmember Cano.
Thank you, Madam Chair. First of all, apologies for getting here a little bit later. My car was having some problems with the snow and the ice on the windows. So slowly made my way in here to avoid crashing into anyone. I just want to say I appreciate this report. I appreciate the superintendent's acknowledgement that this was something that she decided to take on and to bring forward. I think that being a part of a very large organization, I remember when I used to work at Minneapolis Public Schools for the district, obviously here as a council member, it takes a lot of time and intentionality to really tweak these systems to ensure that your employees and your staff and your workers are feeling supported and that you're moving everyone in the right direction. So this is really helpful for me to see and to hear. My question, I appreciated all the other questions that came before mine today, and I had similar questions. So I just want to focus on one specific one, which is just more of a technical process question. So the motion here today is to directing staff to publish the report. And I noticed that on our website, what you just walked us through is not available right now for the public. So I'm curious about the timeline for publishing or uploading that, just so that, I can go back to the report and read it, and then other folks who might be interested in reading it too could see it.
So Councilmember Cano, that's a good procedural question. What's different about Audit Committee versus other committees of council is that actually the report gets sent out 24 hours, or in this case, the Friday before the meeting, to all of the committee members, and it's not published until we accept it and order it published. So today, after this committee, I will have a motion to receive and direct staff to publish, and that's when it becomes available to the general public. So that's the typical way that we're doing these reports the first time they come out. And that's different than every other committee that we're on. So that's why it's like that.
So would that be up later today or tomorrow?
Typically later today.
Later today.
Yep.
Wonderful. Thank you.
Madam Chair, if I may, and Councilmember Cano, I think one of the reasons that we want to do that is we want to control the communication and not overly alarm people about the topics that we're going to talk about. I think sometimes when you look at audit findings, people can get really excited about it, and we'd rather put them into context and try to tell a little bit more story before we ignite some people's fears or misconceptions. I think the clerk's office They have versions of this. They officially publish it. We add it to our website after the audit committee, so I think it's probably easier for your constituents and others to find it on our website. But I think the clerk does some other official action where it gets published as well. Yeah, you're welcome.
Mr. Fisher, do you have a couple additional questions?
Yes, Madam Chair, thank you. I don't see quite in the report here a recommendation or a suggestion that there be some type of comprehensive and formalized staff training. Part of the report came back and saying staff was unaware of some of the requirements of the safety program, as well as possibly some statutes and ordinances and regulations. I'm just wondering if that is going to be a part of the implementation process going forward, as more staff, formalized staff training.
Madam Chair, Mr. Fisher, part of the issue identified was a communication concern, and I believe that there will be a comprehensive communication plan put together that shares the information out on the established policies. And then I believe
Commissioner Fisher and Chair Palmisano, to respond to your question about formalized training, yes, that is part of what we will be doing, both in terms of what laws and policies that we as an organization are required to follow, but also providing the appropriate training that we need for different work classes in our organization.
If I may jump in, the park board has a pretty unique challenge here because they have a lot of part-time staff and they're seasonal, and thinking about how to systematically train people that come in as a summer job is much more difficult than a typical office environment where you can just drag everyone down to a conference room and give them training. So we've seen good examples of robust training that already exists. I think some of the challenges that they need to figure out are what do these seasonal people need and how do we get it to them in a reasonable fashion, in a way that's not cost prohibitive either, right? We don't want to onboard them for a week and not have the rec center staffed or have all this additional funding that goes to this. So there are some unique challenges that they face, and we recognize that, but we also recognize that training does exist. They do have training. They weren't able to demonstrate that that person X does this job, so they need to be trained on these things, and this is when they last were. So, that will eventually come with a lot of these other formalized processes, but it hasn't been ignored, and we don't want it to seem like training is an afterthought there. There's just some ways that they can improve how they do it and how they track it as well.
And I appreciate the possible difficulty about it, but it occurs to me that if we have seasonal or part-time employees, there even is a greater risk of accident occurrence among that consort than we do with permanent employees. So maybe more attention should be paid on. I'm just encouraging you to really work on the communication program and start it early, since these are compliance issues as well as safety issues.
Yeah. That's a good point. Other questions? I have a couple more. One thing I reflect on as a result of this audit, when I put it down and I think about our park system and I think about the great work that we've been able to do with the park board over this past year, is how do we have the number one parks program in the country when we have some gaps like these in our safety program? So could you put that into context for me a little bit, Mr. Vasiliev, in relation to, or maybe Ms. Miller, in terms of the Trust for Public Land or CAPRA standards? How does that, maybe this is better for Ms. Miller.
Yeah, thank you, Chair Palmisano. The rating that we get from the Trust for Public Land is about access to parks, the ease of access within a 10-minute walk, percentage of residents have ease of access, to the dollar investments that we make in our parks, to the median size of a park in a city, to the number of recreation centers and number of playgrounds we have per capita. So it's very data-driven based on physical assets and access to those assets. It doesn't, one of the challenges, and I've had conversations with the Trust for Public Land about that, it doesn't look at ongoing maintenance practices, ongoing safety practices. It's really based on the raw assets that we have and the access to those assets relative to other cities. It does not mean, however, that those other factors aren't looked at, aren't important, which again is why I think, as Commissioner Walensky is aware, we have systematically been trying to look at how we do the work that we do at the Park Board for over 6 years. And we're a large organization. It takes a long time to get through every piece of this. So safety, we've made some strides. We obviously need to make more significant strides in those efforts. And I think it's more about our system as an organization, how we ensure that our leaders in the organization and our frontline employees who are doing work know the protocols and know what requirements are, and if they have complaints, where they can go to get that, to share those complaints, where they can go to get the data they need about safety protocols. To me, it's one more piece of the puzzle of work that we've been doing for 6 years at the Park Board to bring us, as Commissioner Walensky said, into the 21st century.
Thank you. It's good to know that while this isn't something that's going to help bolster our measures in those aspects, the accreditation process certainly there doesn't go through the same level of review that you guys have undertaken with this effort. So thank you. Great. With that, I would like a motion to receive this report and also direct staff to publish it to Councilmember Cano's question earlier. Seconded? Second. Great. All those in favor, please say aye. Aye. Opposed? Ayes have it. So the report will be received and staff will now publish this report. Thank you. Thank you to the Park Board for being here today. Next on our agenda, we have the Minneapolis Police Department third-party audit report. Mr. Tetzel, I understand, will present this report today, but I also want to thank Stephen McDaniel for all of his work on this one. Thank you. Go ahead, Mr. Tetzel.
Thank you, Madam Chair.
Oh, and actually, before you do, I do want to introduce that Deputy Chief Glampy is here in the audience to be here and has worked with you through the process of this. So thanks.
I would actually like to start by recognizing the police department. They've been probably one of the departments that has recognized how audit can be used as a valuable tool, and are the one department that has come to us most frequently to ask for help. And so I think some credit is due there. We're also working with a couple folks in civil rights that work with PCOC,
the Police Conduct Oversight Commission.
That one. And the police department's newly established quality assurance team collaboratively to try to understand who's getting the type of coverage within the police department, that it's adequate, learning from each other, helping each other both from administratively, how might we conduct audits, how might we do testing, potentially some peer review. So we look forward to some pretty amazing things happening in that front going forward. This audit wasn't on the audit plan as presented last year at this time. Over the summer, the police department came to us and asked for some assistance in some troubles that they had with invoicing through a mental health professional for critical incident services. And we thought it was an interesting body of work since we had moved that large off-street parking audit into this year. We felt like we had the time to address this. Also mentioning that we should also look at the processes within the police department and get a more holistic view of what this issue might be. Some of the things that we factored into consideration were labor agreements, the critical incident policy that the MPD has, and the contract that they have for mental health professional services. They've spent, since 2007, $153,000 on these types of services and have had contracts in place since 2012. So clearly the objectives of this audit were to get a better understanding of why, when we receive invoices for these services, it wasn't easy for us to reconcile with whom we've referred to the mental health professional, and what changes or improvements the police department can make to ensure that going forward this doesn't continue, or we can do a better job there. We have two findings here. The first one has a few components. Finding one is critical incident referral documentation and invoice approval process. Currently, or in the past, the police department didn't have a formal, well-secured, well-documented process for how they refer officers, confirmation that the officer went to their debriefing with the physician, and timing of when they're coming back to duty. But one of the requirements is a return to duty determination. So there's a lot of timing factors in here, and the police department does have a really strong appetite that officers that are involved in critical incidents get the help they need. There just wasn't a great way to keep track of this. One of the circumstances that sort of unfortunately happened was the city didn't offer up a way to identify officers without using their names, and the mental health professionals that we were using for these debriefings also weren't comfortable putting private information on these invoices. So we came to this dilemma of having an invoice that we couldn't reconcile to say, yes, we think this is all the services that we've asked for, and we're happy to pay this. Secondly, the invoices weren't going to the people that, if we had that information, could do that reconciliation. So the police department understands, we've also talked to AP about it, that we should improve this process of getting this to the right person, but also upfront working with this mental health professional to say, we're going to refer to Officer X as this code that no one could potentially decipher, and please invoice us with this information so that we can understand what we're paying for in that whole process. And I think it's a very simple thing to do. The police department understands that too. So a lot of easy fixes here. The second finding relates to the critical incident policy. And one of those components is that a return to duty determination needs to be provided by a maybe a physician to the chief of police before an officer returns to active duty. There wasn't any evidence to support this activity happening. It may have been happening. Just the documentation and the archiving of information around here did not support any conclusions to be made there. Our initial verbal recommendation to the police department was, does this need to be in the policy? If it's not happening, does it need to happen? Do we need to change the policy, or is this really important, and do we think it needs to happen? And their answer, which I respect, was, this is important and we think it needs to happen. And so as a part of this probably very easy fix for this dilemma that we're in, that can be another data point that they track to make sure that before an officer returns to active duty, that they've received this determination from a qualified physician, and we've done our diligence to make sure that our officers we're protecting our officers before they go back out and get exposed to the potentially sort of emotional and physical hazards that they deal with on a day-to-day basis. And those are the two findings from the audit. We weren't able to get a better answer on the past invoices from the mental health professionals. So that might be something that we try to do, or we drop it. But we know going forward that they'll have a better process to figure that out.
Thank you, Mr. Tetzel. Questions and comments from the committee, Mr. Neal.
Thank you, Madam Chair. Mr. Tetzel, I want to ask you to clarify this your comments about the return to duty determination. So, are you saying that you just couldn't document that there was at some point a mental health professional said, "Yep, I've examined this person and they're okay to return to duty"? So that might have been occurring verbally on a phone. There just wasn't a written documentation of it. Am I understanding that right?
Madam Chair, Mr. Neal, the mental health professional that we had been using in the most recent past was not qualified to do this determination. So it wasn't happening with this person. We don't have any evidence of officers going elsewhere, but we don't have any evidence that they weren't going elsewhere. There's not a formalized process to handle that. Because of the type of work that this debriefing is, I think the police department recognizes, and us too, that it makes sense that sometimes you need just an entirely different mental health or health professional or physician to do this determination. And so that's where we're thinking like it seems like they're not happening, but we couldn't be conclusive that they weren't happening because there wasn't a way for the police department to document it.
So the management response too to this question, it feels to me like there should be a paper trail from whoever is doing the fitness for duty on through to when the officer returns to duty. And it doesn't quite say that in the recommendation, at least to my understanding.
Yes, Madam Chair, Mr. Neal, there should honestly be, in my opinion, a paper trail or a data trail for everything related to this.
You agree there ought to be, or that there is? Is that the question?
There ought to be. Yes. I haven't seen anything that makes me believe there is for this certain circumstance. Okay.
I don't mean to cut you off, Mr. Tetzel, but Ms. Trammell, you have something?
Thank you, Chair Palmisano. I think what we may be missing here and what may be adding some confusion is that the labor contract actually has a double negative in it. It's after this visit, the referral to the mental health provider that the person is not fit to return to duty. You're not required to have a fitness for duty. If the mental health provider determines that the person is not fit to return to duty, then there needs to be some action taken. And I think that DC Glampy can add more to this. I don't have the contract in front of me, but I think we're getting a bit far afield from what was designed here.
Thank you. Deputy Chief Glampy.
Thank you, Madam Chair. I'm Travis Glampy. I'm the Deputy Chief of Professional Standards. And Mr. Neal, to answer your question, hopefully I can kind of put it all in perspective here. So what we found, and we've since revamped our process based on this audit, is going forward, we've already implemented this on every critical incident. Per contract, the officers are required to go to a debriefing with the mental health professional as explored in this audit. There's also a clause in the contract that we are following and have started following that says if you're involved in a critical incident, you will also go for a fitness for duty examination, and that actually goes through a medical psychiatrist. So now we do have kind of a bifurcated process where the officer sees one person for a debriefing, and then they also see the doctor who provides us with a paper trail that says yes or no. Yes, they may come back to duty, or no, they need some more time. So I think this audit, I'm very pleased that this audit pointed that deficiency out, because this audit was spurred by a report we received from a mental health professional that said, well, I'm not qualified to do that. Well, that makes no sense to us. So we were able to since implement this. So we have a solid paper trail, and the officers receiving all the care they need, but we're assured as both the police department and the public that our officers are fit to come back to duty after this incident.
Very good. Thank you. I appreciate that.
Thank you. Commissioner Walensky.
Thank you, Chair Palmisano. I was noticing that these are often multi-year requests for proposals, so you have a multi-year contract with the provider. Is there some system in place other than the initial contract where their credentials are reviewed to make sure that they're up to date annually?
Madam Chair, Ms. Walensky, no, there is not. And that is one thing. This audit was also timed so well that we have an RFP process. The contracts have expired, and we have a new RFP process out. So that is going to be one thing included in there is an ongoing vetting of the professional to make sure they are in good standing. And along with one of the things we found as a result of this process is there is a conflict, and if Ms. Trammell could correct me, we found there's a conflict between HIPAA and the Minnesota Medical Records Act that our previous contract did not cover. So our timing is absolutely perfect that we are going to correct that when we choose our providers. Any contract that we go forward with them will include not that clause that takes away the secrecy to the city as to who's being billed, and also allows us to look at things like ongoing vetting of the professional to make sure that they're in good standing and giving us the services we need.
Well, thank you, Deputy Chief. You just answered my second question as well.
Thank you. Any other questions? Mr. Fisher.
Along that same line,